So first, today our lecture is thyroid gland. So thyroid gland, please remember, it is one of a very important topic of systemic surgery. Many MCQs are asking from the thyroid gland. So thyroid gland, you must have to know the anatomy of the thyroid gland. Also, you must have to know some of the important point in relation to the embryology of the thyroid gland also. Okay. So why embryology is important? Because there are some important, you can say, clinical correlations हैं, which they can ask you in relation to the embryology of the thyroid gland. So first of all, we must have to start from the thyroid gland. So see here, first important point what you must have to remember, that thyroid gland, it is a butterfly shaped organ. It is a butterfly shaped organ. Okay. And its weight is around 20 to 25 grams. Its roughly weight is about 20 to 25 grams. And please remember that most of the iodine which is present in your body, it is stored in the thyroid gland. It is stored in your thyroid gland. Okay. So most of the iodine, you can say more than 90% of the iodine, it is stored in your thyroid gland. Okay. So now you must have to, I will show you the picture of the thyroid gland. See here. Now this is your thyroid gland now. Okay. So thyroid gland, please remember, uh, embryological development, you must have to know that thyroid embryologically it is developed from thyroid embryologically. It is developed from a thyroid diverticulum. Okay. It is developed from a thyroid diverticulum. Okay. Which arises from the floor of, which arises from the floor of, which arises from the floor of primitive pharynx. अभी बताऊंगा why it is important. From the primitive pharynx, and then it is going to descend into the neck region. Okay. So thyroid, please remember, it develops as a outpouch in the primitive pharynx. ठीक है. Diverticulum का मतलब ही ये होता है, it is an outpouch. So it develops as an outpouch in the primitive pharynx, arises from the floor of the primitive pharynx, and then it is going to descend down into the neck region. Okay, then it is going to descend down into the neck region. Second important point, please remember, this is the development of the thyroid gland. But along with thyroid gland, if you see that behind the thyroid gland, there are your four parathyroid glands also. So we must have to know the development of the parathyroid glands also. So please remember, parathyroid glands, they are developed from the third pharyngeal arch, third not arch, third pharyngeal pouch, and they are developed from fourth pharyngeal pouch. Fourth pharyngeal pouch. The parathyroid gland, it is developed from third pharyngeal pouch and fourth pharyngeal pouch. But if they are going to ask you from where the third pharyngeal pouch, which part of the parathyroid gland is developed, it is the inferior parathyroid gland, which is developed from the third pharyngeal pouch along with the thymus. So thymus and inferior parathyroid gland, it is developed in the third pharyngeal pouch. Fourth pharyngeal pouch, इससे आपका developed हो रहा है your superior parathyroid gland. The superior parathyroid glands are developed in the fourth pharyngeal pouch. Inferior parathyroid gland along with the thymus, they are developed in the third pharyngeal pouch. And fourth pharyngeal pouch, may one more thing is also developing, and that is your parafollicular cells. Okay, parafollicular cells. So please remember, parafollicular cells and parathyroid, superior parathyroid gland, they are developed in the fourth pharyngeal pouch. This is your important MCQ from your embryology. Third pharyngeal pouch you're developing is the thymus gland and your inferior parathyroid gland. Okay, so these are the important points in relation to the embryology of the thyroid and parathyroid gland. One more important point you can add it here is what? That there is a third pharyngeal arch, third pharyngeal arch, and there is uh, fourth and sixth pharyngeal arch. Okay, fourth and sixth pharyngeal arch. So please remember, fourth and sixth pharyngeal are important, which you must have to remember in relation to the thyroid gland. Why it is important? Because from fourth pharyngeal arch, there is a development of your cricothyroid muscle. Cricothyroid muscle. From the sixth pharyngeal arch, there is a development of your all intrinsic muscles of the larynx. So all the intrinsic muscles of the larynx are developed in the sixth pharyngeal arch. Okay, except यहाँ पे आपका आएगा except which muscle? Answer is cricothyroid muscle. Cricothyroid muscle it is developing in the fourth pharyngeal arch. Okay, अब देखें fourth and the fourth pharyngeal arch is having its own innervation. Sixth pharyngeal arch is having its own innervation. So these are the MCQs. So please remember that fourth pharyngeal arch, for example, if I write here the fourth pharyngeal arch, it is innervated by your superior laryngeal nerve. Okay, superior laryngeal nerve. Sixth pharyngeal arch, sixth pharyngeal arch. It is innervated by your recurrent laryngeal nerve. Okay, it is innervated by your recurrent laryngeal nerve. तो देखें, in this slide, I explain you the important things in relation to the development of the thyroid gland. Once again, I am revising to all of you. Number one point, which you must have to remember, that thyroid gland, it develops as a thyroid diverticulum. Diverticulum means outpouching. ठीक है, आउटपोचिंग आउटपोचिंग अराइजेज इन द फ्लोर ऑफ द प्रिमिटिव फेरिंग्स कि वहां पे बनेगा एंड देन इट इज गोइंग टू डिसेंड इनटू द नेक रीजन. सेकंड इंपॉर्टेंट पॉइंट, दिस इज योर थायराइड ग्लैंड, बटरफ्लाई शेप्ड organ present in the anterior part of your neck region. This is the diagram of the thyroid gland. On the posterior surface of the thyroid gland, you have these four parathyroid glands now. Now, these four parathyroid gland development is important. They are developing in the third pharyngeal pouch and fourth pharyngeal pouch. Third pharyngeal pouch में क्या क्या बन रहा है? Number one, your inferior parathyroid glands and the thymus is developing in the third pharyngeal pouch. What is developing in the fourth pharyngeal pouch? Your superior parathyroid glands along with your parafollicular cells. जिसको ये जो पैराफॉलिकुलर cells हैं, these are also known as C cells. I will show you in the diagram here. These are your parafollicular cells. So these parafollicular cells, please remember, parafollicular cells, they are also known as C cells, and they are going to release calcitonin and help in the regulation of the calcium. Okay, so these are your parafollicular cells. So if I am going to ask you, parafollicular cells are derived from where? So your answer will be, sir, parafollicular cells are derived from the fourth pharyngeal pouch, and these parafollicular cells are also known as C cells, and they are going to release calcitonin. Okay, then you must have to know the fourth and sixth pharyngeal arches. Fourth pharyngeal arch and sixth pharyngeal arch are very important in relation to our thyroid gland topic today. ओके और इसके ये एमसीक्यूज आ सकते हैं फ्रॉम योर एम्ब्रियोलॉजिकल पॉइंट ऑफ व्यू. तो व्हाट इज द फर्स्ट पॉइंट? फोर्थ फेरेंजियल आर्च muscle which is going to develop, answer is cricothyroid muscle. And please remember, fourth pharyngeal arch The nerve which is innervating your fourth and sixth pharyngeal arch, इसका एक और भी आंसर हो सकता है. The nerve which is innervating the fourth and sixth pharyngeal arch, this is your vagus nerve. Vagus nerve. Okay. But vagus nerve, ये तो है आपकी 10th cranial nerve. But this 10th cranial nerve, when it is going downward, it is going to give inner innervation to the fourth pharyngeal pouch, a fourth pharyngeal arch muscle, or that nerve will be your superior laryngeal nerve. Okay. And sixth pharyngeal arch, please remember, it is going to innervate all the intrinsic muscles of the larynx except cricothyroid muscle. And sixth pharyngeal arch, please remember, it is innervated by which nerve? Answer is recurrent laryngeal nerve. Okay, so recurrent laryngeal nerve, it is the nerve of your sixth pharyngeal arch and it is going to innervate all the muscles of the larynx. Okay, till now everything is clear. Now see here. This is the histological presentation of the uh, thyroid gland. Now, these are your follicular cells now. Now, follicular cells, please remember, follicular cells, they are going to form T3 and T4 hormone. So, T3 and T4 hormones are going to be formed by the follicular cells, and your C cells or parafollicular cells, which are also known as C cells, they are going to form what? They are going to form calcitonin. Okay? They are going to form what? Calcitonin. Clear? 1 second. यहाँ तक सबको समझ आ गया? Everything is clear?
Yes, sir.
Okay.
Yes, sir.
So now see here. So this is your parathyroid gland. So this is the histological presentation of the parathyroid gland. Okay. This is the histological presentation of the parathyroid gland. So these are your follicular cells. Follicular cells, they are going to form T3 and T4 hormone. Parafollicular cells, which are also known as the C cell, they are going to form your what? They are going to form the calcitonin, also known as C cells. Okay. Now coming into this slide now. Now see here this diagram, all students. So number one thing, see here again, you have your follicular cells. You have your follicular cells. You have your follicular cells and you have your parafollicular cells. Okay. And this is your thyroid gland. Now this is the thyroid cartilage. This is the thyroid cartilage. This is the hyoid bone. Hyoid bone. Okay. And behind somewhere there will be your cricoid cartilage. Cricoid cartilage. Okay. Now this is the right lobe of the thyroid gland. This is the left lobe of the thyroid gland. Both these lobes are joined together here by this structure. This is known as isthmus of the thyroid gland. Okay, this is known as what? Isthmus of the thyroid gland. Now, this isthmus of the thyroid gland, it is very important. Why it is important? Because, see here, isthmus of thyroid gland, please remember, it is present at the level of second, third, and fourth tracheal rings. At the level of second, third, and fourth tracheal rings, your isthmus of the thyroid gland is present. Now, this isthmus of the thyroid gland, why it is important? Because when you are going to perform tracheostomy in the patient, you have to cut down this isthmus of the thyroid gland. Okay? And then you can perform tracheostomy between second and third tracheal rings or third and fourth tracheal rings. Okay? So, this is the isthmus of the thyroid gland. Okay? Next important point, see here. So this is the thyroid gland. Now this is the cricoid cartilage now. Okay. So this is the cricoid cartilage. This is the thyroid cartilage. This is your butterfly-shaped thyroid gland. It is having right lobe of the thyroid gland. It is having the left lobe of the thyroid gland. And in the center, it is joined together here by the isthmus of the thyroid gland. Isthmus of the thyroid gland, you already know, it is present at the level of second, third, and fourth tracheal rings. Okay. Now see here, this thyroid gland, which is you have seen in the diagram. This thyroid gland, please remember, it is covered by two. It is covered by your two, you can say, क्या मैंने बताया? Thyroid gland, please remember, it is covered by two capsules. Uh, One is known as the true capsule. Second is known as the false capsule. Okay. So true capsule and false capsule. Please remember, true. What is the true capsule? Please, true capsule. It is the own connective tissue of the thyroid gland. So the own connective tissue of the thyroid gland, it is known as the true capsule of the thyroid gland. False capsule of the thyroid gland. False capsule of the thyroid gland. It is very important. Why? Because this false capsule of the thyroid gland, it is derived from pretracheal fascia. It is derived from pretracheal fascia. Okay. So it is derived from pretracheal fascia. And when it is covering the thyroid gland, please remember, when it is covering the thyroid gland, now it is going to condense and then it is going to attach to the cricoid cartilage. When it is going to attach to the cricoid cartilage, please remember, now see here, for example, this is covering the thyroid gland and now it is going to attach to the cricoid cartilage. So this condensation of the pretracheal fascia, now
Yeah.
your thyroid gland is attached to the cricoid cartilage. This is known as Barry's ligament. Okay. Or it is also known as suspensory ligament of Barry. Okay. So the suspensory ligament of Barry or Barry ligament is, अगर आपसे कोई पूछेगा what is the suspensory ligament of Barry or what is Barry's ligament, your answer will be, sir, it is derived from the pretracheal fascia and forming the false capsule of the thyroid gland. And it is attaching the thyroid gland to the trachea, and when it is attaching it will condense and now it is going to attach to the cricoid cartilage. अब जब ये cricoid cartilage से attach होगी then it is going to form a ligament known as suspensory ligament or Barry's ligament. Now you can ask me here one question, sir, why this Barry ligament is important? So please remember surgically why it is important, because most commonly the recurrent laryngeal nerve, most commonly the recurrent laryngeal nerve can be damaged near this ligament. Okay. तो अगर अब मैं आपसे पूछूंगा क्वेश्चन के recurrent laryngeal nerve most commonly can be damaged around which structure, your answer will be, sir, it is around the suspensory ligament of Barry or Barry ligament where your recurrent laryngeal nerve can be damaged. Okay. So see here, this is the thyroid gland. It is present in the neck region at the level of C5 to thoracic 1 vertebra. Okay. And this is the isthmus and this is the pyramidal lobe. Now this pyramidal lobe is also having one important, you can say, uh, significance. So they can ask you how this pyramidal lobe is formed. So please remember, whenever the thyroid gland is developing embryologically, please remember it is connected to the tongue. It is connected to the tongue by thyroglossal duct. ठीक है? It is connected to the tongue by thyroglossal duct अब इसमें क्या होना होता है, इट मस्ट हैव टू डिसअपियर। नॉर्मली क्या होता है कि इट मस्ट हैव टू डिसअपियर, नॉर्मली it must have to disappear, it must have to disappear. But if it is not going to disappear, if it is not going to disappear, what can happen? It can results in a formation of thyroglossal cyst, ठीक है, और it can lead to the formation of what? Pyramidal lobe of the thyroid gland. Okay. So if anyone is going to ask you what is this pyramidal lobe of the thyroid gland, so you can say, see here, thyroid development kahan thi? It is developing in the primitive pharynx, and then it is going to descend into the neck region. So when it is going to descend into the neck region, it is connected to the tongue by thyroglossal duct. When it is attached or connected to the tongue by thyroglossal duct, what happened that after the birth, normally it must have to disappear. But if it is not going to disappear, it can persist as a thyroglossal cyst, or it can persist as a pyramidal lobe of the thyroid gland. ठीक है। अब आपसे यहाँ पे एक और भी एमसीक्यू पूछा जा सकता है कि थायरोग्लोसल जो डक्ट है, फॉर एग्जांपल थायरोग्लोसल डक्ट, इसका what is the normal remnant of the thyroglossal duct? So the normal remnant of the thyroglossal duct, answer will be what? Answer will be foramen cecum. This is your important MCQ which you must have to remember. Okay, foramen cecum. So thyroid gland, see here. Thyroid reticulum arises from floor of primitive pharynx. Then it is going to descend into the neck region. It is connected to the tongue by what? By thyroglossal duct. So when it is connected to the tongue by thyroglossal duct, normally it must have to disappear. इसे खत्म हो जाना चाहिए. But what happens? If it persists, it can result in a formation of thyroglossal cyst, or it can lead to formation of another lobe of the thyroid gland known as the pyramidal lobe of the thyroid gland. Okay, this is clear to everyone. So see this diagram. This is the pretracheal fascia which is covering the thyroid gland. Okay, so this pretracheal fascia, it is covering the thyroid gland, and when it is going to cover the thyroid gland, it will attach the thyroid gland to your trachea, where at the cricoid cartilage by a ligament known as suspensory ligament of Barry. Okay, and that is the area where your uh, recurrent laryngeal nerve can be damaged. Okay, 1 minute रह गया, 1 minute is left. Till now everything is clear.